Thank you. Final presentation, Andrea Brandolini from the Bank of Italy, Banca d'Italia.
Good morning, and now this is the last presentation, not unlike Jan presentation, and I changed the presentation considerably during the night, and I don't know what I'm going to tell you. And the point is that I'm definitely the least qualified to talk in this meeting because I'm not a scientist, I'm not working in an international organization, I'm not in a policy institutions concerned with epidemics. I work for the Italian Central Bank. So let me, the Italian Central Bank, as all other central banks, mainly have to take care of monetary and financial stability. So they have no specific role for epidemic issues. And let me say, since there is a lot of pessimism going around today, let me say that the response, at least in advanced countries that are the ones that I know, the response to the pandemic showed a lot of resilience. There is something that you take as granted, like the payment systems. And I'm talking about something that concerns the Bank of Italy, the central banks. Everybody would assume to get the money from bancomat, from the telling machines, or to be able to pay immediately. You never think about what is behind that, but everything worked. I mean, there was not a single case of mismanagement. So this means that the institutions are somewhat more resilient than sometimes we think. I'm talking about the institution, I know. But let me come to the COVID. Why I'm talking about COVID? Because we have a very big research department at the Bank of Italy, as many central banks, and we immediately, when everything started, actually we created a task force in January 2020, very early, simply because our governor had been at a meeting somewhere in Asia, if I remember well. So we created an internal task force. We started to try to understand, and some of the people around this table helped us we had calls to understand better because we didn't know anything about epidemic. We established a collaborative partnership with Istituto Superiore di Sanità Bruno Kessler Foundation. And that was interesting because we immediately came to face some of the difficulties, different language, different approach to data and modeling. Apparently we are all educated people, but the tools used in economics are completely different from the tools used in epidemiology and even in other science. The different priorities. Silvio Brusaferro, remember, said the other day, of course, data should be open, but validated data. In our case, we need to think about policies, where to put money and to help the government in our advisory role. And you cannot wait for data to be validated. We need to use imperfect data sometimes. And then there are the confidentiality restrictions in data exchange. So these are some of the issues that we are faced as practitioners, And then there is the G20 initiative. A lot was said yesterday, I will come to that later. So let me go quickly to some points, some snapshots from my experience. The first one was, for the first time as economists, we were facing a recession due to non-economic factors. The origin, but also the developments. And that was totally new for us in advanced countries. We had no memory of the Spanish flu of 1 century earlier. And one thing that economists did was to construct indices of the stringencies of policy of containment measure. There is this Oxford stringency index that was shown by Mark Pearson yesterday, and we are not satisfied with that. simply because that index was not able to capture the differences between regions and local administrations. And you can see from the first chart, and there is a lot of variation. The gray bars tell you that the stringency was different across the country, within the country. But there is a strong correlation with the dynamics of output or employment, and you see it below. So we played with epidemic models together with our colleagues at Istituto Superiore di Sanità, and we even published a paper on +1, and we used this, and I don't enter into the discussion of this paper because it would take time, but it was a very interesting exercise in using the different expertise, and we used the output of this model for our econometric forecasting, and it was improved using our forecasting using this model. But now I come to what is the main, well, let's say the workhorse of economists, and the trade-off between lives and livelihoods. And that is a quotation from a paper. There are many that could have similar quotation. This is a paper by Daron Acemoglu and colleagues. Daron Acemoglu got the Nobel Prize in Economics a couple of years ago. And the typical statement is the one you can read. When the priority is to save lives, a safely focused approach, the economy will have to endure a lengthy lockdown and sizable decline in GDP. For example, to keep the mortality rate in the adult over 20 population below 0.1%, policymakers have to impose a full or partial lockdown of the economy for almost 1.5 years and put up with economic costs equivalent to as much as 25.9% of 1 year's GDP. These are big numbers. Actually, the reality was much better than estimated by the model. Not to criticize Daron, but simply that is the kind of discussion we had among economists, and that is the way of formalizing the discussion. That is the trade-off. You have on the vertical axis the output loss, and the horizontal axis the number of deaths. And you can see, and the lines correspond to different control measures. And the idea is that the policymaker choose one point on this line. So you can trade off a better performance of the economy, but you have to accept more deaths. So that is the way in which the discussion was formulated by many economists. The paper is not about the trade-off. It is about the targeting, showing how targeting by age groups would have been more efficient. But the point is that that was the debate, and if I manage to change, okay. And it is something that I cannot accept, actually, to be very sharp. Simply because, first, we don't know about this trade-off. There is a lot of uncertainty. We don't know how it is shaped. We don't know what is the counterfactual, because people change their behavior and change their behavior even in the absence of containment measures. And so that means that it is not clear what is the counterfactual. And the second and more relevant point is that it is very difficult to use this kind of input in a normative process. So how do you accept to have deaths? So as any policymakers would go for the lowest death, in my view, but probably not. So that is one of the debate. The second point, as I told you, snapshots, and that is something that struck me for the discussion of these 3 days, that there was very little attention to the unequal burden of the pandemic. That is just, I chose one article in the Financial Times that was a German slaughterhouse that were an outbreaks that was in June 2020, yes. But there was a lot of discussion among economists about the unequal burden. That is a fine and very good summary of the issue as put by Anne Case and Angus Deaton. The effects of the virus are stratified by educational attainment. And just go to the last sentence, whereas college graduates have largely been able to safeguard both their health and their wealth, less educated workers must risk one or the other. This is important when we discuss pandemic, because we cannot ignore that people were hit differently from the pandemic. This is important. It was important for us in discussing policies, because it required the most advanced countries that had fiscal space, to use the expression by our colleagues from IMF yesterday, to spend a lot of money to support people, to design new policies. I give you a simple example. The self-employed typically are not protected by the welfare state as employees. And so new tools were used and a lot of money was spent for them. And if you look, yesterday I commented about the poverty dynamics showed by DAS. This is only for Europe. Look just at the dark green bars. The dark green bars are changes in poverty between 2019 and 2021. So over the period of the COVID. In 2021, poverty levels were below the 2019 levels in almost all countries. Exceptions were Slovakia, Germany, and by very little Austria and France. So one should be careful in saying COVID increased substantially poverty. We need more analysis on that, but the huge public spending in that period managed to offset the negative effects on household incomes, especially at the bottom of the income distribution, at least in Europe. Another point that was not discussed much, even if it was discussed in terms of the quality of the publication, scientific publication, is the statistical challenge. This is a paper wrote by colleagues of mine on Vox.eu. The point is that the pandemic created huge disruptions in the collection of data and huge problems for statistics, not only for health data, also for ordinary statistics we are used to know, like GDP or industrial production or many others. So what happened? There was a huge reliance on many new digital sources, most of them private sources, credit card transactions, mobile phone data, and so on. The challenge then and now, that is something that has remained, is how to guarantee, to ensure that the official statistics principles, we want to have data that are relevant, accurate, we want timeliness, consistency, and accessibility. These are critical issues for democracy. So the issue about statistics is crucial and linked to what we have seen. In these 2 days. About the global dimension, that is just a piece of memories. That is November 2020, Daniele Franco was still Director General of the Bank of Italy and asked us to prepare a memo on an initiative at the G20 level. And Francesca Manno and colleagues at the Minister of the Economy did the same, so we had 2 memos. And from those memos, started all the work that brought to the creation of the high-level independent panel first, and then to the joint task force on health and economy, finance and economy later. So that is just a piece of history for you, and let me remember, apart from Francesca and colleagues Gelsomina Vigliotti at the MEF, also Jeremy Farrar was a very important player in this game, because Jeremy was part of the secretariat that helped in producing that document. Now, I'm at the end of my talk. I don't want to spend much time on the global dimension, because everything relevant has been said. Let me just make 3 points. We have a rich international financial architecture. Yesterday, somebody asked, is it too rich or too complicated? Maybe, but we should not forget that even centralized big institutions have a silos problem within themselves. So I don't know what is the optimal architecture, but sometimes it is better to have more than to have less. The second is insufficient financing that was said yesterday, but the long-term perspective of these institutions are what are the thing on which we can build. So let me finish, and that is the title I decided for this presentation. I think that my main lesson from the pandemic experience and from the discussion of these 3 days is that we need dialogue. We need a dialogue at all levels, across disciplinary boundaries. And let me add that it is not only public health experts or people around this table and economists. Probably in this conference we should have had somebody expert of education and to understand that the problems with the child education caused by pandemic. We need a dialogue across countries. This is absolutely essential. It came out very well. And we need a dialogue among citizens, authorities, and experts. Statistics is one point that I stressed. Yesterday, the emphasis was a lot about communication. I think that we should reflect on the difference, at least as I perceived it, between communication and engagement. Because communication is something vertical, from the expert to the people. I think that we needed to go beyond that. It is to engage people. And Richard said, remain open to legitimate contrarian voices. That is absolutely crucial, even if he put the inverted commas on contrarian, whereas I would have put the inverted commas on legitimate, because who is going to decide what is legitimate and what is not legitimate? So my final points are not there, but 1 minute. First, just a statement. Population was not a consequence of pandemic. Population was already there and changing our society. The second point, second statement, pandemic is a very extreme crisis, but we live continuously through crises, different crises. So we can learn a lot from this experience, but we should not think that this is the exception, because there are many other games in play in town. Thank you.